name is Marissa Alari. I'm one of the lead nurses here in 7 West Cardiac and Thoracic Surgery Unit, and I'm here to present to you one of the many projects that our unit have been involved in. And this afternoon, it's about utilizing telehealth and structured post-discharge phone calls to prevent 30-day readmissions in the cardiac surgery patient population. Fortunately, I'm supposed to have my other telehealth nurse who will be presenting with me, but he has an important thing to do, so I'm just by myself. Well, UCLA said, do not be afraid to be great, so I'm here by myself. I wanted also to let you know that in this project, we have the cardiac nurse practitioner who had helped us a lot, which is Michelle Wynn, and also my support from my managers, Sherry Neal, and my former manager, Renee Appleby. Before I start, we don't have any relevant financial relationships with commercial interest in whatever material or instruments that we have used here in this project. So, why did we go about this project? Coronary artery bypass graft surgery is a frequently performed cardiac surgical procedure. But because of changes in healthcare, there's shorter lengths of stay. So therefore, we have fewer opportunities to give meaningful discharge education. And also because Society of Thoracic Surgery database, UCLA cardiac surgery readmission rate is in 2014 is 16%. Also because this year Medicare have changed their reimbursement. Preventable hospital readmissions are very costly. And of course, readmissions have a negative impact on patient outcomes and satisfaction. So the purpose of our project is that a telehealth program that includes structured discharge phone encounters and telemonitoring reduce 30-day readmissions in the CABG patient population. So what we did in our unit, 7 West nurses and CT surgery NPs designed a structured post-discharge telehealth surveillance program. With this, we also revamped our Healing Heart Handbook. It's the education material that we sent out to all our patients. We also standardized our patient questionnaire, which is now incorporated to Care Connect, so all telehealth nurses will be able to see what are the things that have gone through with our discharged patients. We also utilized an informal tool to screen all our patients for risk factors related to readmissions. So for our low-risk patients, they receive 4 or more structured telephone or video conferencing, which is here we use WebEx encounters. And for high-risk patients, we enroll them to Vivify. It's a telemonitoring kit wherein we send patients home with 30 days. For 30 days, they have this kit. This kit has a Bluetooth-enabled blood pressure monitor, pulse oximeter, a weighing scale, and a tablet, wherein there's like questionnaires. They're all related to complications after surgery. With this telemonitoring kit, the team receives message alerts through email, and then whoever that telehealth nurse will access patient data through a secure web portal. And from there, patient issues are managed by the nurse and nurse practitioners with early interventions. So in this graph, you will see the majority of the interventions that we've had for all our patients, be it medication adjustment, patient education, home health, earlier clinic visits, treat heart failure, wound check, or pain control. So depending on issues encountered by the telehealth nurse, the team intervenes. Like for example, for reinforcing patient education. So when they have questions about their surgery, we always make it a point that we ask them regarding if they have their Healing Heart Handbook with them. So this is how we utilize our teach back method. So we guide them in the book, which part of the book that they're supposed to look at. They have questions about wound care, activity, follow-up checkups. So that's what we do with patient education. And if they have problems like increased heart rate or shortness of breath, normally all our patients who are discharged should be seen by cardiac surgery or cardiology within 7 to 10 days. So if they have those problems, what we do is that we ask them to make an earlier appointment with these doctors. And if there are problems that, of course, a telehealth nurse cannot do for them, like adjusting medications or start a new medication, like complaints of chest pain, like increasing beta blockers or adjusting their diuretics, it's going to be the cardiac surgery NP or outpatient NP who will take care of that problem or issues. And if they have problems with home health, because normally they're supposed to be seen by home health within the 24 hours of discharge, we contact them for follow-up just to make sure that they'll have it as soon as possible, or we refer them to the case managers. So as a result, with all these interventions, from January to December 2015, from 16%, we decreased our readmission rate to 8%. And this is just for CABG patients. In the next slide, you will see that because when we started this project, it was 2014, like latter part of 2014, we had a lot of positive remarks from other surgeons. So they wanted to include not just CABG patients, but also other cardiac surgery patients. But you can see the admission rate is higher. We didn't look at this and pinpoint every issues that could have happened, why we have more readmissions for all other cases. But you can see if they have multiple surgeries like CABG, combination of CABG and valve, there's 35%. If it's a combination of transplant, CABG, be it heart or lung, it's 30%. And multiple valves will be 13%. And valve and transplant, heart or lung, is 16.7%. But overall, we still decrease our readmission rate to 14.2%. With regards to our readmission rate for telemonitoring, though we have only like 7 kids initially, and at the end we had like 7 kids and then 13 kids at the end of the year, we still decrease our readmission rate from 60% to 8.8%. We had few valve patients who are highly at risk, so we included them to have the telemonitoring kits, so it's 10.7%. But overall, we still decrease our readmission rate to 8%. So this is a summary of all of the readmissions that we had, and majority of our readmission was actually pleural or pericardial effusion or complaints of shortness of breath. The next one will be like arrhythmia and palpitation, which is 14. Some were altered mental status, pneumonia, sepsis, and changes in the abnormal lab values, like the INR will be too high or too low, or like changes like very low hemoglobin in the heparin, and the rest like syncope, and you'll see the rest with lower numbers, like renal failure, nausea, vomiting, weakness, nutritional issues, or abdominal pain are the causes of readmissions for our project. Here you will see a video. I want I want you to see that video, but I'm just gonna end it and I'm gonna show you the video later. There's no way to play it. Okay, in conclusion, our with regards to our project, there's early detection of common surgical complications leads to early RN and MP interventions, and early interventions such as medical management, patient education, earlier clinic visits, and home health communications are positively impacting readmission rates. And lastly, utilizing telehealth, instruction discharge, phone or video RN and MP encounters reduces 30-day readmissions in the cardiac surgery patient population. So I just want to acknowledge the team who actually made this project possible, especially for our surgeon, Dr. Shiman and Dr. Ben Hurash. Nancy Satu is for our Director for Innovations, and all other telehealth nurses like Shannon, Heng, and Alita. I wish I could show you the. It's very short. It's just 2 minutes. Do you have any questions? This is how our Vivify kit works. So this is like the alert system, and then this is the web portal that we sign into. And when we see any abnormalities from there, we act on it. We call the patient, and there's like a face-to-face time for interventions with patients. And this is when I was reporting it to the nurse practitioner. And this is how we interact to the patient back.